As 2020 comes to an end, people are getting ready for the festive season. In Kenya, this also happens to be the wedding season. So people are getting ready to get together with their families, their friends, and to travel to be with their loved ones. How can we ensure that we stay safe during these holidays? The Environmental Public Health Association of Kenya, also called EFAC, comprising of professionals responsible for disease prevention and control and health promotion in Kenya, would like to share with you tips on how to keep yourselves, your loved ones and the entire community safe from COVID-19. Please take a few minutes and listen to our experts.
Is it really necessary for you to travel? Critically go through this to establish if you really need to travel. If you really need to travel during this festive season, then there are critical things that you need to consider. If it is then a must that you have to travel, then you have to ensure that you put in some critical measures to ensure that you minimize the risk of yourself contracting the virus, or you transmitting or infecting others during that period of travel, and even consequently when you will be at your travel destination. Now, what are these measures that you need to put in place to minimize the risk of infection during the travel? One of the critical things is to ensure that you have adequate physical distancing between yourself and other persons that you are traveling together, if it is public transport, or even within a private vehicle that you are traveling with individuals who you normally do not stay with, because you are pulling together into that vehicle. So consider all those measures that will give you adequate physical distancing within that travel means, be it a bus, be it a matatu, or a private vehicle that you are pulling together. Then the other things that you need to consider, as you have been advised severally by the Ministry of Health, is to ensure that you put on your mask. And during the whole travel, ensure that your mask is on from the beginning of your travel to the end. The other critical thing that you need to put in place is then to ensure that you regularly sanitize your hands as you travel. Some of us will be doing long distance traveling, and during that long distance traveling you might have breaks, you might have stopovers, either for food or for to relieve yourself. During that period, ensure that you sanitize consistently, regularly. Now, if you feel that you do have the symptoms that the Ministry of Health has shared with us over time, you are having a fever and you are coughing and all the other symptoms that have been indicated, please do not travel. And if you then have those symptoms on the way, it would be better that you keep safe, do not interact, especially with members of your family who are at high risk of, if at all they get infected, of severe illness and even probably death. So because you love them and you care for them, do not go mingling with them if you find that you have any of those symptoms that have been presented or have been in contact with somebody who has been tested positive. Thank you.
People at risk in developing a complication and becoming really ill when they're exposed to COVID-19 are those people living within our families with lowered immune system. So these are the people with weak immune system. So a good example is the elderly, those who are elderly. So we have the young ones. We have those patients, those cancer patients. In addition to that, also we have those who are undergoing treatment, and further to that also we have those who are diabetic and all that. So the most important thing that basically we really need to put in place within our Kenyan context. You know, within Kenya, we like celebrations, we like parties, we like going out to communities and engaging with them, visiting family members and all that. But looking at this situation, we already have these people who are diabetic, who are cancer patients, who require treatment, and then we have those ones who are under therapy. So we basically have also to put in place and in mind a need to actually work closely within our family members and ensure that we do not continuously expose these family members who are living within these specific communities. Now, as we enter into this festivity season, we know, as I said earlier, we like celebration, we like visiting our family members and all that. But right now, we have a low testing level, so we do not know the extent to which this COVID-19 infection has spread. And we're likely to expose these are family members who are at risk. I've already spoken about them. So we basically need to ensure that we're actually able to put in place the minimum requirements for control of COVID-19. That is basically ensuring that we are continuously washing our hands, we are sanitizing, we are wearing masks. Even whenever we're doing parties at home, let us try as much as possible to maintain the social distance and ensure that we put this COVID-19 into control whenever we are. So these people who are at risk, they are likely to become very ill, and if we are actually not able to put in place the various system in place, so we're likely to lose them. And we love our family members. Let us try as much as possible to work closely and ensure that we protect the most at-risk population within our communities. Thank you very much.
So in summary, I am saying, let us keep social distance at least 1 meter, ensure we wear the masks, we wash our hands, we use sanitizers, and ensure that if you must cough or sneeze, you cough towards your hand. Enjoy your festive period and keep safe.
There you have it, FAC's public health experts, explaining how you can have safe holidays this season. So, from the entire FAC family, we wish you happy holidays. Until next time then, stay safe, wear a mask and remember to sanitize.